Now, the Quezon City Epidemiology and Surveillance Division records 944 dengue cases from January 1 to 26 this year, 153 of them from District 5. Joining us via Zoom is QC ESD's Chief, Dr. Rolando Cruz. Good morning, Doc. Thank you very much for joining us.
Good morning.
Doc, let's take a look at the numbers here coming from Quezon City. Some people might be wondering if this is a spike or if this is normal in terms of their numbers. Is there a comparison to last year's numbers for the month of January when it comes to dengue cases? Is this higher or lower, or is this just the norm?
So this is actually very unusual for this time of year. No? Usually the number of cases will start to go down after a spike during the typhoon season, like September, October, September, and then start to go down by November, December until January. But since last year, we are seeing a continuous case increase of cases into an epidemic level. So if you're going to compare the cases for Quezon City right now, it's not it's the latest number is at the end of January 31. So it's at around total of more than 1,000 cases already. This is 137% compared to the same time last year. No, so that's this really very unusual for Quezon City in terms of cases.
Doc, you mentioned 137% increase compared to last year. Is there any reason that your department has identified, especially in particular sa District 5 po, where from the data from Jan 1 to January 26 says there were 153 people from that district with dengue?
Yeah, that's correct. No? Particularly, the cases are coming from the Barangay Gulod. No? So we're looking at the intermittent rains that are actually happening after the series of typhoons. No, so and there are rains, no, or stagnant water, clear stagnant water in the community. Marami talagang lamok. No, there are going to multiply more mosquitoes in the community, and therefore, if there are dengue cases, more transmission of dengue will happen. No? So this is actually we're also looking at climate change. No, so
Yeah.
although it's very difficult to connect everything, but that's what's happening right now. No, so more rains it means more water in the community or the stagnant, more breeding sites for mosquitoes, and then it's very difficult to remove all these breeding sites. There's going to be a transmission of dengue cases in the community.
There has been a consistent effort when it comes to the communication of ways to fight dengue, anti-dengue notices, and of course, basically pieces of advice to try and prevent the spread of dengue and address stagnant water, as you mentioned. From the point of view of the local government, what are the recommendations made, especially to those affected areas, to try and more aggressively address this growing problem in QC?
So it's quite a challenge right now. No? So especially in a very in a depressed community, or wherein if you're going to do a search and destroy activity, no, so it's like everything in the community is it's a breeding sites of mosquitoes. So it's very difficult to communicate. No? So what we're doing right now is we are really going house to house, no, investigating cases so that within those community, people will learn, no, on how to search and destroy and how to avoid having a stagnant water in their areas. No? So, and then also with with the help of the barangay, we do a chemical control. No? We immediately do chemical control for all those areas with clustering of dengue cases, no? So that we kill the adult mosquito right away, no? So that's the purpose of that. And then in our health centers, no, there are dengue test kits, no, that can be that can help diagnose, no,
Yeah.
cases with fever, no, so that we immediately quickly diagnose if this is dengue, and therefore we can manage it, avoid serious complication or even deaths, no. So that's what we're doing right now in the local government units.
From a medical prevention perspective here, Doc, obviously there was a dengue controversy that did affect the confidence of people when it comes to the dengue vaccine in particular. In your opinion, Doc, just how important is it for a dengue vaccine to be approved soon, especially considering the troubles that you've had here with the 137% increase this year?
Yes, I've been saying this in a lot of forum already. No? So the dengue shock controversy we can only end it by a good dengue vaccine. No, so and it should be implemented strategically. No, so that we can finally end the dengue shock controversy. We need really a vaccine. No. In other countries, this is their main intervention for dengue cases, so that they avoid deaths. No, so because if you have persistent increase of dengue cases, it can actually reach those children that are vulnerable, probably have a lesser resistance to dengue, or have a lower immune system, no? So that when they have this dengue virus, they are more likely to have a serious illness. I think the dengue vaccine is appropriate.
Yeah.
Which should be implemented strategically in the Philippines, no. So at least that's what actually my opinion on that. And then the only way that we can end the dengue controversy is really a very good a dengue vaccine that can be implemented in the community.
Doc, we really appreciate your honesty and, of course, your opinion and the updates with regard to the QC issues and their dengue outbreak there. We hope that the numbers do go down, and we hope to talk to you again very soon. Thank you very much for joining us.
Thank you for inviting us.
Right, that was Dr. Rolando Cruz.